Okay. Good morning, everyone. My name is Núria Casanova. I'm a fourth-year plastic surgery resident in Girona, in Spain, and I would like to do my farewell presentation after my month here at Asa Medical Center. First of all, I would like to introduce myself. I was born and raised in the wonderful city of Barcelona, which some of you might know. It's a very nice city because it has a lot of nice buildings, thanks to Gaudí. You might know Sagrada Familia, Parc Güell, Casa Batlló. We also have very good gastronomy. Mainly in Spain, the food is quite good all around Spain. And also we have a very nice and warm weather all year round. For my medical school, I went to the Pompeu Fabra University, which is also in Barcelona. And behind here, that was my faculty, we had the teaching hospital, which is the Hospital del Mar. In Spain, it means Seas Hospital. You might guess why. Every morning it was really nice to go there and see the sunrise. Also for the patient, it was a really nice place to recover. From my recent years, I developed an early interest in surgery. Every time I could, I would go to the OR, and I would also scrub in. And also in summer, I would do summer rotations in general surgery, gynecology, vascular surgery. I also participated in the Gimernat Surgical Society, which is a medical society for people who are really interested in surgery. At the time I was the president, we could organize the first international congress called Scalpel for medical students, and this was my team at the time. We had a blast organizing. It was a really hard time, but it also was very rewarding. And also in Spain, as our final thesis from medical school, we have to do a final thesis, and in my case, I did a work with the chief of vascular surgery regarding a hot topic at the moment, and it was whether it was possible to predict the long-term survival after carotid endarterectomy with some lab test results, the platelet to lymphocyte ratio, the neutrophil to lymphocyte ratio. Spoiler alert, it was not possible, but it was a hot topic at the moment, so we could publish it, and I was very happy to start doing some research from my medical years. Also, a little pearl, if you know any medical student who is really interested in surgery, you can tell them we have this congress every year in Barcelona, so it's a nice opportunity to be there. It's a 2-day congress and also a nice opportunity to visit Barcelona and Spain. So they are all invited, and the fee is not very high, so anyone can go. Regarding my residency in Spain, we study 6-year medical school, and then we have like 7 or 8 months of hard study just to take one exam, that is a national exam, and you apply then for our residency. In my case, this day, it was a mix of feelings. I feel happiness. I felt also I was really nervous. But then at the end, I got to choose plastic surgery in a small city, that is this one, Girona. It's a small city, 1 hour by car from Barcelona. You might look some resemblance to Florence. It's because it was rehabilitated after the Civil War, looking like Florence, with the riverside, with these colorful houses. Girona is famous for 3 things. The first one, it was because the cathedral was the setting for Game of Thrones recording the Walk of Shame. Then the second one is because we have a lot of very good restaurants. We have the 3 Michelin star Celler de Can Roca, which I haven't had the opportunity to go, but hope one day I will be able to go. It's very hard to get the reservation there. And then the third thing is because lately, a lot of professional cyclists come and train there because we have very nice roads, also mountain biking. But this also gives us a lot of polytrauma patients, which is quite good for us, or maybe not. And also half hour by car from Girona, we have the Costa Brava, which is a very nice place in the Mediterranean Sea. If you ever have the opportunity to go, I really encourage you to go. It's very nice in the summer, also too crowded, but it's nice after the on-work call to go there and spend the day in the beach. This is Cadaqués, which is the city that the painter Dalí really liked, and also here he had a house there. Well, regarding my residency, we have microsurgery in 2 big hospitals with mainly our activities breast cancer and skin cancer reconstruction. For the reasons that I told you before, we also do a lot of lower extremity trauma. We also have 3 secondary hospitals where we do general plastic surgery, not microsurgery. And in all, we serve a population of 1 million inhabitants, not as much as here in Korea. But we are 7 attendings and 1 resident every 2 years, which is, I think it's nice, the ratio, because we get to do a lot of things. Well, The reason why I chose to do a medical rotation here at Asa Medical Center was easy because it's a worldwide leading hospital in supermicrosurgery and lymphedema. And we want to start treating those patients at my home hospital. So that's why the reason I came here. Regarding what do I take home, for sure is going to be the wonderful team of plastic surgeons that I have encountered. It was really nice to put faces on the names that I knew from the PubMed article, so it was a nice thing to know you. Also the supermicrosurgery and lymphedema knowledge, and for sure also the diabetic foot and oncologic reconstruction, because we have a lot of these at my home hospital. Well, it has not also been in the hospital. We could, with the Spanish group that also have become like siblings to me, we could visit all Korea, Busan, Jeju, and also do this in the highlight of the cherry blossom. Was a nice opportunity to me. It was for sure the highlight of April. Also the good weather. You can see we had a lot of sunny days. And as my future goal, for sure, it's going to be surrounding microsurgery. I think as reconstructive surgeons, if we have the tool of doing microsurgery, we can achieve like anything we want. If you imagine it, you might possibly do it. Also in my hospital, this was last February, I attended an ultrasound course Dr. Paloma Malagon organized in Barcelona with my senior resident that was here last year. I don't know if you remember her. We want to start using Ana Badal, you know. Very tall girl, yeah. It was really nice because we will start doing lymphedema and also the design of the flap, so we are just starting. And here in that picture, I was a second-year resident in a flap cadaveric dissection course in Madrid, only surrounded by senior resident and attendings. So I've always been a freak with surgery, but it was nice to get to know all these people, and also because for me it's important. I don't ever want to stop learning. So I think plastic surgery is a specialty where you never stop learning. That always like puts you on place. And as my future goal, the OR is my happy place. So I really enjoy being surrounded by nice people, nice surgeons, nice nurses. So for me, my happy place is the OR. So I hope I will stay and enjoy a lot of plastic surgery. So thank you very much. Hamsamida. And that was all.